September is Prostate Cancer Awareness Month, and a new spotlight was put on the disease after former President Joe Biden announced that he had been diagnosed with a late-stage aggressive form of prostate cancer that had spread to his bones. Now, his case has sparked a lot of discussion within the medical community about the need to improve current testing guidelines for the disease by considering more than just your age. And here to join us with a conversation here is Dr. Murray Goldberg, a local urologist with Tampa General Hospital. Doctor, thank you for being with us. I was sharing with you, near and dear to my heart. My grandfather passed away from prostate cancer because he was not checked early enough. And I have two uncles who have it right now. So definitely common, but definitely can be treatable.
Correct.
Because you need to test early and often. So explain the testing guidelines.
Well, the guidelines, it depends whose guidelines that is.
Okay.
I mean, if you go back to the United States Preventative Services Task Force, they pretty much put a kibosh on some of the screening. But in general, since 2018, I think their policy is that between age 55 and 70, you should have you should at least have a discussion regarding the use of PSA. Now, obviously, I think that has to be refined a bit because we have here in Florida, we have some of the youngest octogenarians, and I think it's hard to basically put a cutoff. I have people that come in that they're clearly going to live until they're 100, and there are others that not. So,
So what advice would you give to people watching?
Definitely exams. Okay, first of all, there's been a lot of controversy about it, the value of a prostate exam. Okay, that's the digital exam. I think it's quite valuable because 80% of cancers occur in the area of the rectum, and so therefore it's easily palpable sometimes.
Okay,
So,
and you can get just a simple blood test, right?
you can get the simple blood test, but the blood test isn't perfect, and that's part of the controversy. You could have the worst cancers actually don't make PSA. So the blood test, I mean, there are urine tests, there are blood tests, but again, the purpose of a screening test is really to find people that are at risk. And not just of having cancer. As you said, it's very common to have prostate cancer cells present, but the key question is whether or not it's going to impact the quality and the quantity of your life.
Okay, so what are signs and symptoms? What do you want people out there to know?
Actually, that's the problem. There really are no signs or symptoms for prostate cancer specifically. That's why you do have to, I mean, over the age of 40, you should be having a prostate exam. Over the age of, well, they say over the age of 55 right now, is according to USPF, PSTF, to have a PSA, but if you are African American, you should probably be getting it younger. And if you have at least one or two family members, primary family members that have prostate cancer, you should even consider earlier at age 45.
Goodness. That's, I mean, and so is that something that your doctor should bring up, or is that something you need to advocate for yourself?
Well, I mean, considering there's been a lot of controversy and whether you should probably advocate for yourself, but the doctor should. Number one, you should be getting a prostate exam, which I think is becoming a lost art.
And tell me a little bit about, really quickly, you find the cancer early, it's very treatable.
Correct, but that doesn't mean all cancers are treatable. I mean, obviously, if you get it early, then you have a much better chance at controlling it or curing it. Obviously, if it's more advanced, it's problematic.
All right, well, thank you so much. Good information. And we have a lot of females who watch this show, so they can make sure that they're nudging their loved ones, their male loved ones, to make sure that they're asking the proper questions and make sure they're encouraging them to get that screening. Thank you so much. Appreciate your time. If you'd like more information or to watch this interview again, you can go to our website, WPDF.com, or our free mobile app.